Now, if you have the disease of addiction and your drug of choice is something else, for example, cocaine or methamphetamine, we typically don't utilize medications like buprenorphine for these disorders because those particular drugs of choice don't carry with them the significant risk of overdose and death. However, when we're talking about opioids, these are specifically very lethal. It's very easy, for lack of a better term, to die from an opioid overdose than it is other drugs of choice. So we utilize medications like buprenorphine, which fall under the trade names of Suboxone, Zubsolv, and those drug classes. Now, with buprenorphine, it is a significantly valuable medication because we know that it decreases opioid overdose deaths to a significant degree. So these medications become significantly invaluable. Because when we're talking about opioid dependency, it's very, very difficult to simply stop using medications like opioids. The withdrawal, the subacute withdrawal, and the post-acute withdrawal from opioids takes a long time to get over. And when you have an opioid dependency, trying to get past that hurdle just to get to the deeper issues that are at hand is very, very difficult. So we utilize medications like buprenorphine for people who have opioid dependency because they have tried over and over and over to get past these various stages of withdrawal without success. And it's not because they don't want to, it's because physiologically it's close to impossible. Now, there have been cases, of course, where people overcame the opioid dependency without medications, but these are the exceptions to the rule. And unfortunately, in abstinence-based recovery programs, they look at these few instances and hold everybody else to those standards, and that's simply not fair. So with buprenorphine and Suboxone and Zubsolv, these medications are opioids in and of themselves, but they do not carry with them the overdose risks, meaning that you can take a large amount of medications like these and not die from an overdose. And the added benefit, if you use an opioid on top of it, it decreases significantly the chance that you will die of an overdose.